Good morning, everybody. How are you all? Taster series time check in, and it's day 4 in the taster series. I've managed to get on. Now, life is hectic for many of us this morning. I was supposed to get on 5 or 10 minutes ago, and of course we had lost school shoes that completely disappear, so we had to find a completely different pair. So what I'm saying is, things always happen as busy mums, things offset us, and we tend to not do the smaller things, even just for ourselves, and we can be rushing around like crazy throughout the day. So what I really want you to make sure you do is, no matter what happens, is still try and take those 5 minutes. The normal mummy tummy challenge exercises you can do in 5 or 10 minutes. And with the stretches and with your connections, you can still do those. So even when you have like the craziest, busiest, stressful day, you can still be going around and thinking about your core muscles, or even just getting down going, right, that's it. I'm not going to do the washing. I'm actually just going to do a couple of leg slides or some hip bridges. Okay, so try and fit those things in. Okay, so the main topic today is, when we've spoken about activating your core muscles, often some of us have stronger pelvic floor muscles or stronger transverse, or both are weak. So what do you as an individual need to be concentrating more on when you exhale? So we talk about activating our core muscles on the exhale, and we activate pelvic floor and transverse together. Now, generally speaking, those who have had a C-section don't need to worry about the pelvic floor muscles because they're automatic. They're as they were pre-pregnancy. Brain's using them automatic. We don't have to constantly think about them. If that's your situation, when I say exhale, you think about your transverse only. All right. Now, also, why I'm just here, I'm going to come to the pelvic floor in a minute, okay, is we can have weaknesses on one side. This can be, again, related to our biomechanics. It can also be related to how baby presented. If baby's on one side more, stretching one side more, or there's been damage, if baby's being posterior, damage down on one side, neurally that can reduce how well we're firing up the muscles on one side. Now, it can happen with the transverse, and it can also happen with the pelvic floor muscles. Okay, also as well, a past injury. I've got, a lot of you know who've seen me before, I've got a shocking weak left knee. It affects the pelvic floor muscles also on this side, so I have to think left. All right, so if you're transverse, if you're finding, when I check my clients, I often say, well, this one's not firing up as well as this side, send the brain and focus more to that side, because this other one will start to fire up automatically. Okay, so if you're noticing a weakness on one side, concentrate on that side as you exhale. Now, pelvic floors. So generally, for those who have had a vaginal delivery or interventions or noticeable leakage, pelvic floor weakness, something doesn't feel right, we need to contract the pelvic floor and then transverse. Now, a little bit confusing here is my transverse abdominals switch on automatic. If I think about my pelvic floor muscles, they're already switching on, so I don't really often have to think about the transverse too much. So if I think about my pelvic floor, my transverse is switching on. So you need to play around with that, guys, and see what suits you. Also, we spoke about hypertonic pelvic floors. Now, hypertonic pelvic floors can still have symptoms of a little bit of leakage, absolutely for sure, pain during sex, sore abdomen, so pelvic pain. If you think you have any of those, and it tends to increase with exercise, that's a pretty good sign that you could have hypertonic pelvic floor muscles. Okay, so what that means is, so if we have really tight muscles, and this affects more women than what is spoken about. Okay, so your pelvic floor muscles need to give a little bit, so they're constantly like a balloon. So a little bit of pressure, give, so they're nice like this, like a trampoline really, so they should spring back. Now, if they're a little bit leakage, like in my case, they're a little bit saggy, okay? So that's why they're not working, they're not sort of bouncing back up. Now, hypertonic pelvic floor muscles are like that well done steak. They're not really moving. So you guys don't have to think about lifting them up anymore because it's going to make those symptoms worse. You actually need to think about relaxing the pelvic floor muscles. So what I get you to do is relax. On the inhale, think only transverse. On the exhale, nothing else, okay? That's really good exercise for you guys to do. So you don't think about your pelvic floor muscles if you think you have hypertonic. For the moment, okay, we think about relaxing them. For those of you who are struggling with TA, focus on that at the moment, getting that zip up. We have to. If you have a mummy tummy, if you've had it for a long time, generally speaking, it's the transverse that are not working, and we need to keep that low level zip up focus going, because over time, upper abdominals start to override it, pushes it down, and gives you that pooch again. All right, guys. Hopefully, I know it's going to be confusing. You know, I've worked in this industry for so many years. So we learn things at different stages, which helps mentally get your head around things. For you guys, I'm giving you all this information at once, okay, not necessarily knowing the biomechanics. You might have been told by somebody else how to contract your core muscles differently. Try and stick with this. Again, I know it is a lot. Any questions, let me know. Put your videos on. Let me know how you're going. I still want you now to think about more of your individual core function and strength, and take that with you with the 10s, okay? So if you know your pelvic floors are weaker, I want you to do 10, 10, 10 of the pelvic floor lifts throughout the day. If you know you're on the transverse, do those. If you're struggling with both, you do them both together for the 10s. All right. Any questions, guys? Let me know. Please comment. I will talk to you all tomorrow. The last time we run the taster series was in lockdown, so I didn't have any clients, and I'm pretty hectic with clients at the moment. So back to back, all in the morning. So I'm really struggling to get on live with you guys at a regular time. Tomorrow, I really want to try and do a stretch and balance workout for you here live on Facebook. It's probably going to be in the afternoon because I think I've got clients till about 1 o'clock. But I'll check that for you. But I really want to do that because I want you to help relax, de-stress, and connect. All right. See you tomorrow. Any questions? Let me know, guys, and I'll talk to you all soon. Also, everybody, for those of you who've signed up to the No More Mummy Tummy Challenge, you're going to get the access details today, which includes all the videos, assessments, so you can choose what level you're on. So next week, you can ask me the questions to make sure you're using the right level for you and for your strength and function. Bye, everybody.